Sanjana.
Good evening, everyone. I'm here to talk about my study on quality of life of COVID-19 associated mucormycosis patients at 18 months follow-up. Imagine a rare fungal infection which affected 0.14 per thousand, surged fourfold in a year. This is rhino-orbitocerebral mucormycosis in India during COVID-19. So what fueled this crisis? A study of risk factors in our institutional cohort showed host factors such as poor glycemic control, environmental triggers such as steroid misuse, and systemic failures such as overwhelmed healthcare. All this triggered a deadly disease with a mortality of 4,332 deaths. So what happened to the one who lived, the survivors? Multiple studies reported on immediate post-treatment period outcomes, but there are hardly any data on what happened to the patients in long term. No data on disfigurement, vision loss, mental health, or socioeconomic trauma post-recovery. Our objectives were twofold: to evaluate long-term treatment outcomes in terms of mortality, vision, cosmosis, and overall quality of life, and to quantify the physical and mental scars using SF12 surveys. We used an ambispective cohort study on COVID-19 associated ROCM patients. All the patients were treated with amphotericin B, and few of them underwent surgical interventions such as sino-orbital debridement and enucleation. So we included 69 patients in our study, out of which 13 patients died, 11 patients went against medical advice, 45 patients were discharged. These 56 patients were followed up, and among that, 66 patients died, 13 patients were lost to follow-up, and 37 patients were alive. These patients, we conducted our survey on these 37 patients. And the results, we found that 62% of the patients had poor mental health score and 43% had poor physical health score. In terms of work challenges, over 40% experienced occupational impairment, both physical and emotional challenges due to ROCM. About 30% reported difficulties in climbing stairs and other moderate physical activities, including pushing a table. The pain and subsequent mental distress experienced by patients also affected their social activities. 14 out of 37 complained they felt downhearted and blue persistently. Coming to the conclusion of our study, mental health impacted more severely than physical health. Physical challenges weren't that easy either. 26% had a blind eye. 11 out of 37 needed additional surgeries, including enucleation. Disfigurement, social stigma, and grief associated with the loss of family to COVID-19 compounded to their mental decline. One patient quoted, "I survived ROCM, but I lost my confidence, my job, and my loved ones." So the key point of our discussion is that survival is just the beginning. Survival is not same as recovery. Economic ruin remained an invisible scar. The study also threw some light on healthcare's blind spot. At the end of our study, we realized quality of life remained compromised. Patients now face two new challenges. One is to rebuild their shattered lives and to heal their physical bodies. So to turn survival into meaningful recovery, we propose three things. One is to integrate QOL metrics into routine follow-ups, to deploy multidisciplinary teams such as psychologists and social workers to heal both visible and invisible scars, to fund long-term care programs for affordable and accessible rehabilitation. I'd like to conclude by saying ROCM isn't just a deadly infection, it's a life-altering condition. Thank you.
Thank you, doctor, for highlighting. We often ignore the post, part of these diseases. Did any of your patients need exenteration?
No, ma'am, we don't usually do exenteration in...
Because the ones who did were even worse off
Yes.
mentally, having a hole in the face.